if you think about healthcare, it's really a combination of a patient, a provider, and an instrument. Like
Hmm.
it's hard to remember the last time any of us got care without some kind of technology or equipment or instrument being involved.
Right.
Whether it's as small as a thermometer to take your temperature, that's
Hmm.
still a device. Whether it's a scale to take your weight, you probably have one in your home, still a
Hmm.
device. Or a vitals monitor, whatever it is. You're probably touching a machine every time you walk into a dentist office or a medical office or a vet or an optometry office. Doesn't
Hmm.
matter.
All right. Welcome back to Exploring Growth. Today, we're looking at perfect storm that's happening for medical providers with my guest, Jinesh Patel, co-founder and CEO of Uptime Health. Welcome to the show, Jinesh.
Thanks for having me.
So it's kind of cool. I literally just got off a podcast recording with Brandy Birch, founder and CEO of benefitbay.com, where she's in the employee benefit world. And we were talking about, I said, hey, I'm about to jump on with Jinesh here in a minute and talk about providers and how they're kind of, handcuffed on the other side of patient care.
Yeah.
But it was cool. I haven't ever had the kind of bookends or back to back. We're in the same kind of conversation where we kind of ended up like, hey, we need a little more democratization of healthcare and employee benefits so people can choose. And you're seeing that on your side too, right? We talked about this kind of when we got introduced. When you're working with the providers themselves, and they're handcuffed in terms of how they're getting paid and who they're getting paid from, and the person paying for a lot of these benefits and then trying to utilize them is the one that's caught in the middle. So I wanted to first, let's start out with telling people who you are, get a little about your background and what is Uptime Health.
Yeah. So my name is Jinesh Patel, one of the co-founders and the CEO of Uptime Health. Uptime Health, we're a software tool that helps providers manage their medical equipment. Basically, we help them keep it from just breaking down unexpectedly, knowing who to call whenever something does break down, and utilizing the data that's being aggregated in our system, such as like failure rates, cost of ownership, all that stuff, and predicting when you need a new device before you know it. And we hyper focus in the outpatient segment. And today we're really, really close to the dental market, but we sell into medical, veterinary, optometry, basically
Mm-hmm.
anyone who uses medical devices to take care of patients that doesn't have an in-house expert like myself, a biomed engineer or biomedical technician to kind of tell them what to do. So our software kind of augments the need for us at some level.
Gotcha. Yeah, that's super interesting. And, I think right now I have another client who's in the ophthalmology space, a consultant ophthalmologist. And I hear from her too that, it's such a weird time for medicine. I mean, it's like the perfect storm of cyber attacks.
Yeah.
You've got inflation that's going on, decreasing payments from provider or not from providers, but insurance companies or payers. There's an educational curve on a lot of things that's happening that comes out new. I mean, let's start with one of them. One that I know in talking to her is cyber attacks. We've seen these happen, and they just sort of take out. It's almost like a grid. They take out a ton of providers, and they're literally going back to handwriting on pen and paper because their system is down and down for months.
Yeah. I think that was what we all saw a little bit of what happened with the Microsoft outage. That wasn't a cyber
Mm-hmm.
attack.
No,
That was just a patch or an update that was
right.
corrupt. But the actual like entail of what happened to the businesses and the people
Mm-hmm.
who use those businesses, like whether you were stuck for a flight or a lot of hospital systems were using, Microsoft based environments that had CloudStrike as a background, and they were going back to pen and paper.
Yeah,
So it's just
it's
cyber
nuts.
is that, but more unexpected, and usually you don't know where it's coming from. So it's just that extrapolated. That's how I would feel about it.
Yeah, and it's even more involved because you've got people who are with the ransomware, they're holding all your data ransom essentially. And then if they get paid, they're like, "Oh, we got paid, we'll do it again." I mean, it's where does it end, right?
No, it's just a crazy world. And I mean, we even understand that world from the equipment side because a lot of ransomware attacks can happen through the medical equipment itself. A lot of
Right.
them talk to the cloud or the internet systems.
Mm-hmm.
And so if it's not a very secure infrastructure, that's just a vulnerability point that people are coming in through. Now, I know a lot of manufacturers do a lot of their own just penetration testing and making sure their products are good and safe.
Mm-hmm.
But because our company also can integrate with the medical equipment itself and see how the device is saying it's doing. So it's like, the fridge that's beeping at you because it's going overheating because somebody cracked the door open and didn't close it all the way.
Yeah.
Like, it can self-sense issues and let you know what's going wrong with it.
Mm-hmm.
So at Uptime Health, we've been integrating with these machines and saying if there's an error code that it's sensing, if we know that's a component that needs to be replaced, let's auto dispatch a technician with the replacement part in hand versus them coming on site, trying to diagnose a problem, realizing it's this certain part, then going back to the shop, maybe spending a day till they come back to you tomorrow with the part in hand and then fixing it. And so we've had to deal with a lot of just questions around cybersecurity on the way we integrate with devices. And so to protect against it, we basically say, one, we're not touching any patient data. It's all equipment performance data.
Yeah.
So there's really not a lot of great things to steal already.
Sure.
And then you have the fact that we're doing read-only data down to our system because we're doing the secondary, call it either dispatching or the analysis of what we need to do with that data. So we're all finding ways to create a connected world with less vulnerabilities, but it is taking like some thought and effort to make sure we do it the right way.
Yeah. And it seems like the end goal really is patient care, right? I mean, that's what all the companies that I meet and talk with, their founders or people that are on the front lines, even delivering the services, they're there to make a difference about the patient and the care that they're getting. And, when you said the dispatch someone automatically with the part in hand, I mean, that sounds like an ideal world that, we would be living in that, is that even possible? And it made me think, downtime, which goes right back to the name Uptime, right? Yeah. Like the amount of downtime that they would have in not seeing patients, and you start to kind of have a ripple effect into the patient experience, and not even just their customer experience, but they need to get in and see a doctor, and if there's a piece of equipment down, that is vital to what they need to be doing there. They need that up. So I think it's kind of interesting that what you guys are posing here, and you kind of paint this picture of someone showing up with a part in hand. Like, has that happened? I mean, it seems unreal.
Yeah. We're legitimately in the process of right now. We have our first 2 devices that are active on the platform that can do it, but you need more for more data points.
Oh,
so we're literally convincing manufacturers that it's okay to work with us because it's part of getting their own dev cycles to integrate with us is important.
Sure.
But then also letting them know how we're doing it, making them know this is not creating another vulnerability point, because they want to make sure that they're not creating a bad world for their patients that are being or the patients that are using their devices either. So we have a line of people that want to sign up or get with us, but it's going to take some time. And hopefully by this time next year, we might have 10 to 20 devices. And then by the next year, we might have like 100 plus. And so we'll get there. But I would say that there's something to your point that's very accurate. The downtime is not just about the machine and the cost to repair that machine and maybe the small operational disruptions or big operational disruptions that happen in the office, because every moment that machine's down, they're not charging for services. So that's just missed revenue. But then to your point, if you actually have a real problem that you need a sophisticated machine to see you or diagnose you because of what it is, and that's down, that's your time, energy, and money that's being sucked away. And then you have to reschedule. You probably already took off work. You probably already put in PTO or sick leave to go to the doctor. And now you have to do it again.
Well, and then
every prolonged day could potentially be a worse and worse outcome. So that's just one part of it. The patient suffers tremendously.
Yeah.
And today, the backups for scheduling appointments.
Oh, yeah.
Some procedures are 2 months out.
Yes.
So that one day of down isn't you're going to get tomorrow. It's everyone in the line either gets shifted or you get slotted somewhere a little later, or you wait 2 months until there's actually the next opening. So there's a lot of just things that.
And as a patient, you're sitting there kind of shaking your head as to, I don't understand why I got pushed. The things that come to mind are the type of equipment that not every facility has. Like, there's a lot of very expensive equipment that when it's down, well, now there's a lot of facilities don't even have this equipment. So if you're the only one that has it and it's down,
Yeah.
Well, the amount of those patients, they just have to wait. I mean, and those typically are the more critical types of situations that patients would be in.
It's interesting because it's like it's a double edged sword. There, you have those specialty maybe machines
Mm-hmm.
that are usually done by specialty providers because it takes a sophisticated person to work on a machine that nobody else really has or works on.
Right.
And because there's not a lot of them, that also means that people who traditionally see or repair those machines, there's not a lot of them either.
Mm-hmm.
It's kind of like a supply and demand curve. So if those people are all busy, it's actually probably a longer lead time to get a more specialized machine up and running, unless you're paying a lot of money to the manufacturer to have a true preventative maintenance program on it or a full service contract on it.
Yeah.
And that again increases the cost to own that machine, increases the cost to service it, and then the patients have to bear it, or the insurance providers have to bear it.
Yeah, I imagine the cost gets real crazy when we talk about hospitals that have lots of moving parts. But if we just look at private practice, your typical providers that see a lot of patients every day, you're meeting with a lot of these providers, you're talking to medical professionals. It seems like they're getting squeezed from all sides, right? I mean, we talked about cyber attack. That's a big thing, but probably less likely. You have inflation that's happening with the price of everything,
Yeah.
decreasing payment from insurance companies. How are they handling all of this?
They are really struggling. And I will give you an example from the dental industry, because that's the one that we have the most penetration in and talk to the most. In the dental world, insurance is a little bit different, right? It's not even considered medical insurance. It's its own insurance. And the way that they reimburse are set rates that really don't change very often, or they haven't changed in a while.
Right.
But the cost of labor has escalated tremendously since COVID. I think they were talking about a 20 to 30% increase in just the traditional support staff, whether it's your front office person, your office manager, your hygienist, or dental assistants. There's just an increase across the board. Then you have the actual supplies and consumables, whether it's the fillings or the actual things that you're utilizing to fix somebody's teeth. Those have also increased 10, 20%.
Mm-hmm.
And then you have like just the general overhead, and just the patient populations that are coming in don't really fluctuate too much. Like, it's pretty stagnant. So you have a higher cost basis. Your revenue basis, which hasn't changed, stays almost stagnant. So the dentist is the only person really getting squeezed in that whole system, because they're traditionally the owner of their business too. They're not relying on some big bank. And I think that's important for people to understand, is big health systems. They're just big. And they have a lot of financial backing. They have a lot of different ways to make money. They have a lot of different specialties and things that they're offering. And they have their own outpatient things. And so they can weather some storms. I'm not saying it's easy for them. But the single doc office owner or the single dentist office owner, it's their bottom line. That's their pocket, their take home. And I think there's a stat that said today, the average dentist makes less than they did 10 years ago.
Wow.
So as everyone else's salaries are kind of taking, the right track record with inflation and just general.
Yeah. And the purchase power of that dollar is less too.
They're going the other way. So it's a very interesting dynamic. So that's just one proof point.
Yeah. It's very interesting. And also, no one wants to go to the dentist. I mean, who wants to go and get their teeth drilled on no one. I mean, most people don't, right?
Yeah.
In fact, I read a while back that the suicide rate was the highest in any profession because of the fact that everyone comes in negative. And I have to say, I'm probably one of them, like I don't ever want to go. And when I do, it's not fun. Yeah. So I have to go and pay more as the patient. And then they're getting squeezed even more than I am, but they have to put a smile on. That's a tough job.
I now make it a point to have friendly conversations with the dentist or anybody I go in, because now I'm on the other side, and I was the same, right? I was like, oh, my teeth are going to poke at it, and I have highly sensitive teeth. I don't want to deal with this. And I'd probably make them feel pretty miserable before. Yeah. Now I've changed my tune, being a little closer to it.
Yeah. It's almost like the restaurant industry. You go in as a customer and you order people around and your food's not hot and this or that or the other. Mm-hmm. But if you go work at a restaurant, you realize that's a tough job too, So I'm sure you have that insider knowledge that's probably changed the way you see medical in general, but definitely dental.
Yeah, same thing with the restaurant analogy. I used to be a host, like while I was in college, just
Hmm.
feeding people, and people get frustrated at the long lead times, and I'm like, or
Yeah.
wait times. I was like, I don't control the demand.
Yeah.
You're telling me what the answer is, and so I'm very kind to those people, the wait staff. My wife
Yeah.
used to be in, the bar scene and the restaurant scene, so we
Yeah.
do. We kind of have now felt enough of the world where we're I think good people to be around, no matter where we're
Yeah.
at.
Yeah. Yeah. That's a good thing. It's a good thing to pass on. I think that the trick there in the restaurant world is just to always blame it on the cook, because no one ever sees the cook. So that's what the waiters, the servers are always say, yeah, we got a new cook back there, and they
Oh,
don't know what they're doing. And then you feel sorry for the waiter, but they're the one that put the order in too late,
you always have to have
right?
a boogeyman, and like to
Oh,
just
of
make
course.
to dispel any issues. I agree with that.
So what? So in our original conversation, kind of leading up to this, I was really excited about this because I know I want you to draw a line between what you guys are doing, which it seems like a very business oriented, efficiency driven, ROI kind of positive type of business model, right? Like you can go to the business of running a medical facility. You can talk business and say, hey, look, we do all these things.
Yeah.
The uptime, right, is going to be greater. The revenue is going to be all the things that are business. But I think that's not really what drives you as much as it does. You were saying access to healthcare.
Yeah.
To connect the dots there for me.
That's a great question. So the way I think of the world, I have a biased lens as being a biomedical engineer that cares about the equipment.
Mhm.
What I was ingrained, or what was ingrained into me, especially while I was working at the health systems, was how important medical equipment is just to the equation of healthcare. And if you think about healthcare, it's really a combination of a patient, a provider, and an instrument. Like
Mhm.
it's hard to remember the last time any of us got care without some kind of technology or equipment or instrument being involved.
Right.
Whether it's as small as a thermometer to take your temperature, that's
Mhm.
still a device. Whether it's a scale to take your weight, you probably have one in your home, still a
Mhm.
device. Or a vitals monitor, whatever it is. You're probably touching a machine every time you walk into a dentist office or a medical office or a vet or an optometry office. Doesn't
Mhm.
matter. So if you think about it that way, that's the equation. A lot of this either solutions or the way that we think about healthcare is always revolving around the provider and the patient, and we ignore the technology aspect a lot,
Mhm.
especially when it comes to managing the care environments. So if we think about access to healthcare and we're moving care from these big hospital systems into your communities, into your homes, it's not just the patient and provider that have to make that same journey. It's also a device or an instrument too.
Mhm.
If you have nobody like me that really knows how to take care of that machine, that really understands the ins and outs of it, that we're now utilizing for diagnostic value, for life safety
Mhm.
value, all of these things, people know less about the machines the further you are away from a health system. And that's just because you don't have experts and it's too expensive and it doesn't make sense. It's very understandable why that happens.
Mhm.
But if I want to consume care in my community and in my home, I want to make sure that the equipment I'm using is always calibrated, up to date, and maintained.
Mhm.
And that I can't say is happening today without technologies like Uptime Health ensuring that it's happening. Because there's too much turnover in these outpatient and in-home environments because people turn over a lot in these kinds of jobs.
Mhm.
But even if you had the institutional knowledge to know how to take care of these things, it's probably out the door in less than a year. And so how do
Right.
you bring it back? You need systems and tools to just kind of automate the understandings, the learnings, and everything like that.
Mhm.
So the access problem is making sure the equipment is also great in those environments,
Mhm.
but it's also making sure people can service and repair in those environments. So this is the
Mhm.
other half of the problem.
Mhm.
There's not enough technicians today to support the number of medical instruments that there are in the world today, or even the US. Not even the world, just even the US is a good example.
Hmm.
So if we do have things break down, then we have to wait for a technician to come do the repair and get it back up and running. In the health system environment, you have technicians that live in the basements, that work in the hospitals, that can go floor to floor and take care of things within a pretty reasonable amount of time.
Right.
And if something does break, then go to the basement, grab their part, go back up to floor 7 and fix it. And that's
Yeah.
kind of the journey. In the outpatient setting, the density of devices, which might be 10,000 per building in the health system world, is now 10,000 across 1,000 locations in the outpatient world. And so you have a logistical burden now that you're putting an already undersourced labor force through. So
Yep.
they have to now drive, they have to go through traffic, they have to check in, check out, grab gas. There's a lot
Hmm.
of things that make this an inefficient way to take care of equipment. And because people know less about it in those worlds, it breaks more often. So there are more emergent repairs demanding these technicians that now have to do,
Hmm.
maybe one repair per building instead of 100 in the old scenario. So
Right.
there's a lot of these things that we just need people to understand how to better take care of their equipment in those environments, to make sure things aren't broken, to make sure people don't have to come out and fix it, or else you, I, and everybody else will be waiting 1, 2, 3 weeks in the future
Hmm.
to get our life safety or our medical equipment back up and running. And that actually creates more of a healthcare crisis than an access solution, because we're more reliant on the world that we built,
Hmm.
which might actually crumble if we don't service it correctly. So
Yeah.
that's the part that I'm trying to get ahead of and let people know. Tools like mine actually improve access because it makes sure all the equipment's up and running and we have just good quality healthcare at the same time.
Yeah. I love that. That's a great sort of philosophy and vision. While you're talking, what comes to mind is, are you planning on having providers have an on-staff person that understands Uptime Health and can interface, like they're sort of the user, the go-to user of the facility?
Yeah. The way that we're trying to build our product is I actually don't want people to spend a ton of time in the product. I
Hmm.
want them to spend the time that they need to spend in the product. So
Right.
if it's just to check on what's going on with their machines, you should be able to do that in a couple minutes and get
Right.
out, because your job is taking care of patients and making sure that just your staff is operating correctly. Equipment management should almost feel passive because you feel like you're doing a good job with it.
Hmm.
So you check in maybe in the mornings, make sure you're doing all your daily, weekly, monthly, quarterly checks. That might be a person who is responsible for that task. So there might not be a power user, but just an end recipient of a task.
Hmm.
And then there might be a office manager who checks like once a week to make sure things are done. And the more connected my company becomes with the equipment around it, the less you have to worry about somebody in the tool, and you eventually get the push notifications or just receiving the benefit of the tool now that it's active. So
Yeah.
that's my hope, is we come into this world where you're not really in my product. I obviously I want you to be for analytics that you want to get out of it,
Sure.
but the product is telling you what's wrong and
Hmm.
helping you get ahead of it from becoming a problem. So if I
Yeah.
can trend maybe an ambient temperature
Yeah.
inside of a room that's increasing for no reason, that's not a good sign. So maybe I proactively alert the office manager saying ambient temperature is above normal threshold. Let's see
Hmm.
what's going on. So it's like
Hmm.
they're kind of just getting alerts when
I
they need.
like that. Yeah, but in the current day, having the reactive where they can jump in there and see, oh, we heard the machine doing this, or it kind of sputtered. Let's see if it showed us any data. Um, that is giving them data that they didn't have before to make decisions on the fly. And
Yeah,
maybe they don't need to call a repairman at that moment, but they're going to know, okay, well, maybe we need to restart it. Maybe we need to shut it down, let it cool off, or something needs to happen with this machine, and we can be part of that
yeah.
now, instead of waiting and not knowing. I mean, knowing versus not knowing is what we're talking about. And then it kind of makes me think, all right, well, you've got your suppliers, you're talking about the development cycle you're trying to get into. I would think that they'd be all over something like this because it gives them eyes into how their machines are operating in the field
Yeah.
post delivery. And I would think that they would be your biggest champion once they understand how it works.
They're starting to become our biggest champions just for the reason you identified. And I think the other thing that we can look at is that whole repair replace cycle analysis that we do in real time. So going
Mhm.
back to your point, if something's broken, then you can just scan that QR code we put on your machines with any phone,
Mhm.
and it will pop open the device record. And in that, while you're clicking request service, it'll actually say, this is marked as a replaceable item. So do you want to spend good money after bad? Do you want to wait for a technician to come out here and spend their travel fee and their labor fees? Or do you
Yeah.
just get a new one because the data says get a new one?
Mhm.
So what you've done there is you've actually created a solution in real time. You've reduced the need for a technician to come out. So
Mhm.
that labor force is now one less open service request that probably wasn't needed to begin with.
Right.
We're going to come in and tell you replace it. So it saves him or her a truck roll.
Mm-hmm.
So there's a lot of these benefits that you can get today that are going to help the ecosystem. The automated world is just more of a cherry on top, but today you get a lot of benefits already.
Yeah, you're helping that person in the office make a decision quicker and
Yeah.
more informed, which leads to all kinds of benefits. And then I think the data to the supplier, the equipment manufacturer, is vital for so many reasons, for future development and all dollars spent behind that, and future sales. Because if I don't know if they have salespeople going into these offices, I assume they would. Depending on what they're selling, they're going to be able to say, well, we've got data on the last 5 years of using these type of equipment, and look, this is how it's gone. And can our competitor give you that data? Well, no, they can't. So there's a huge gap that maybe we're more expensive, but is it worth knowing how this is going to perform in the next 5 years?
Yeah, these distributors and these manufacturers, they love us for that data alone because people are utilizing our tools to manage their stuff and do dispatching, and we have that repair replace analysis score. We've de facto become the best lead gen engine for anyone selling equipment into our clients to know what they're going to buy. And we're
Mm-hmm.
doing it with data. So we're not telling you to sell them like snake oil or something they don't
Yeah,
really need. We're
yeah.
telling you, give them a quote for a new sterilizer because we've identified even to them that they're going to need a new sterilizer. So
Mm-hmm.
be a good steward in their sales process. Be more of a consultant versus somebody trying to hit a quota. And that's actually creating a lot of benefit for the customer who might not trust the salesperson
Mm-hmm.
and the salesperson to actually spend their time efficiently. So it's a win-win on both accounts. And then the manufacturer in worlds like dentistry and even outpatient medicine, where the manufacturer isn't always the direct seller. They go through distribution layers. Like a big company in dental is Henry Schein. They're also really big in the medical space. And what happens is manufacturers sell all their stuff through them. And Henry Schein is also in the dental world, the service layer. So
Okay.
if something does break down, they're dispatching Henry Schein technicians to take care of them.
Mm-hmm.
But what happens is all of that failure history and all that repair history, because it's not going back to the manufacturer in any of these worlds,
Mm-hmm.
they don't really understand how their equipment performs in the real world either
That's right.
because they're not doing the repairs. They might sometimes get enough complaints to be like, that one part is faulty across the board. We've replaced 100,000 of them. You need to
Mm-hmm.
recall it. Those might trickle up, but it could be the innocuous things that somebody comes and has to hit reset a few times or has to tweak this thing all the time and they don't
Mm-hmm.
realize it's such a problem. And if we can give them the data that says, here's how your machines perform and here's what's failing the most, then the next rev, they can fix those problems that we didn't even know about. So it's not even that
Mm-hmm.
they don't want to fix it. They just didn't even know about it to begin with.
Yeah, it seems like all that data is only going to make the Henry Shines of the world more effective, smarter about what they're doing. It would change their business model, or it would change their business. It's undoubtedly, because more data is going to change, but I think for the positive. And of course, the manufacturer is going to be changed for the positive, and that relationship probably would be stronger between the manufacturer and the Henry Schein layer. Man, I'm really starting to think through the implications of the data, having that. And it makes me come to mind, like, I'm thinking about researchers, just as kind of random, but researchers writing about the medical world and, getting back to access to patient care and what patient care actually looks like. If you have the data on what equipment is actually being used, you can see, okay, we have this office. It's sort of like, let's look behind the curtain and see what instruments were actually used,
Mm.
what period of time over, for what type of procedures. Um, offices are going to see so much more efficiency because they're going to say, well, we don't even need these things that we thought we were
Yeah.
using, but we're not. Right. But if you're looking back, 2020 and saying, how can we improve medical care for the patient? There's a lot of data that's going to tell a lot of stories in there. It's super interesting.
Yeah, I agree with that, which is we're all on the tip of the iceberg for the medical data world. I
Mm-hmm.
think other industries have done a pretty good job or a decent enough job to realize data was going to be immensely important. And they've been able to mine them or at least now standardize them better than they have before to create clean data sets.
Mm-hmm.
I think in medical, because data has always been a touchy subject, right? Because a lot of it's protected information. So it's not that they don't want to share. They just maybe didn't know how to share at the beginning because the world wasn't secure enough to share this very sensitive stuff. But I
Right.
think what we can do as a medical industry is identify the data sets that don't touch patient information and start making a concerted effort to make those better. So equipment performance doesn't have to touch medical, it doesn't have to
Hmm.
touch patient data. Even building performance, like whatever it might be, or flow, or how
Right.
do you ramp up a front office person, or like,
Hmm.
all these things. There are lots of data around it, but it's just not, I don't think, mined, or at least mineable in its current format. And as people can kind of step up and start exposing it in a positive way, I think we're going to find a lot of benefit.
Yeah, I agree. And, another thing that kind of comes to mind is this squeeze point that all the providers are having with all the things we mentioned. It seems sort of dystopian that, why would you even want to stay in that profession, right? Like there's so many things against you.
Yeah.
But I think if they were to really take a harder look at their business from sort of this perspective that we're giving,
Hmm.
and that you're giving with your tool and your company, um, I think that it would help them to rethink how they operate, like how they actually practice medicine, what their business model actually is. I know I've seen a lot of primary cares go to concierge services where they'll have a flat fee every month and they only take on a certain number of patients. That's one example, I think, of someone changing their model and getting back to actual patient care and
Hmm.
not just being kind of part of the system. But I'm sure there are other ways that could come from the data. If they were to sit with a consultant, probably, or someone that understands business and also understands their business, and were to say, okay, well, what are we doing the most of, and how do we streamline so that we can actually get back to making a profit and paying our physicians well, because them being paid because they're showing up and bearing the burden of all of this is going to lead to better patient care. Machinery taken care of, front desk taken care of, all the things that you just go down the list of all of the touch points.
Yeah.
Um, I think it's going to really, I think that's a great inception point for them to start thinking more like a business person rather than a dentist or a physician.
Yeah, and it makes you feel for them too, right? These are people,
Sure.
dentists or medical professionals that went to school for, 5,
Years.
10 years
Yeah.
post regular
And lots of
graduation.
medical debt. Yeah.
And not just in medical debt, but those last 5 years were all about just how do you become a good patient care provider? And there's
Hmm.
not a lot of information about how do you run a business.
Yes.
A business is already hard enough.
Yeah.
Taking care of patients is extremely hard. So
That's
you
right.
have these doctors who run their own companies, truly,
Hmm.
and they're not really trained on how to think about running a business. They're really
That's right.
trained on how to think about taking care of their patients the best way. And so you see a lot of these doctors in the past, especially in, dental can do a lot of improvements here too, is they were just making good money without even trying, because people need care and care is expensive. And,
Mhm.
even whatever your overhead is, you're still probably making good bottom line. So there's no incentive to be super efficient. There's no incentive to be like figuring out the best EBITDA. Now, the people who care about money and patient care, like they're the ones that kind of started tweaking that first. But
Yeah.
I'd say the vast majority of these doctors are really just there about the patients. And you have to kind of beat into their head like, hey, you're overspending here. Why don't you have a just in time inventory for these select items and have stocked inventory for these items?
Mhm.
You're not paying overnight shipping. And so
That's right.
a lot of these small tweaks that a general person who didn't just focus on patient care for 5, 10 years, but we focused on just living in the world and kind of seeing how businesses run and being in the business side of things, like
Yeah.
that's obvious to us. It's not obvious to them. So I think there just needs to be just more of a collaboration on all fronts to be like, let's help you help us and just
Yes.
listen to us because we know more about this than you do, but we'll listen to you all day about patient care because that's what you know more than I do about.
Yeah. And I think that's a perfect place to end this because it really ties us back to the beginning where I was talking to Brandy on the last episode, I'm talking to you here now. I think the trifecta to this is I need someone to come on and talk from that perspective of like maybe a business consultant that only works with primary care practices or dentists or
Mm.
whatever, and helping them think like business owners, because that would sort of round it out all from a business standpoint too. I think that would be a lot of fun. So if you know anybody or you meet anybody,
I do
let me
know a
know.
few. If you want names, I know a few.
Yeah,
So
let's do it. Yeah, I would love to have them on.
and I'll get you the names and their information to see if you want to bring them on.
Yeah, that'd be awesome because I think that's such an interesting perspective that we all know that they're doing their best to run a great practice, but they weren't trained in that.
No, and I'm fortunate enough to have the lens of being in a family with a lot of doctors, and even seeing my friends go through that whole grind. And it was funny. The reason that I'll kind of end on this note here too.
Yeah.
The reason it came to my mind as to like why we might have an issue here, and seeing that it's more of a people not being good businessmen that shouldn't be good businessmen. They should be good
Mm-hmm.
patient caregivers,
Mm-hmm.
or businesswomen. I shouldn't have said just men. But at the end of the day, what happened is that we had HubSpot, which is a software CRM tool that we utilize
Yep.
for marketing and sales. And I was talking to my friends about that too. And they were very confused as to why do we need a CRM tool? Like, what is that? What does that
Mm-hmm.
mean? And these are people who went like Harvard Medical School.
Super
They're
smart people.
not
Yeah.
dumb
Yeah.
people, but they
Yeah.
just don't grasp the concept of why that's important. They're like, well, don't people just know that? Or, like
Yeah.
it's one of those, they ask good, curious questions, but the fact that where they started asking the question was very like in a low understanding point. And by the time
Yeah.
we're done with the conversation, they were ranked up to being like, oh, that makes sense. But
Yes.
the baseline is very low unless you start asking questions, and many of them
Right.
don't because they don't need to.
Right. Right. Yeah. That's such an interesting topic. So yes, I want to talk to somebody. So that's great. That's great. I love it. Hey, thanks for being on. And if we want to send people your way, where do we send them?
You can find us online, uptimehealth.com, just like it sounds, UPTIME health.com. We're very active on socials. Everything's basically the at Uptime Health. So you can find us anywhere if you need questions answered or just want to look at what we've got.
That's awesome. Thanks a lot, Jinesh.
All right. Thanks, Lee.